This is a picture of lunate in wrist. Lunate stay at the middle line of the proximal raw wrist. Lunate is surrounding the cartilage surface, adjacent with the radius, capitate, triangular, and scaphoid. Multiple ligaments connect the bone of the wrist to each other. Remains stable. And fall down, palm of the hand touch the ground first. The wrist is extremely stretched. The external force is the gravity from top to bottom and bottom up reaction force. The lunate bone is squeezed at the lower end of the tibia and head bone is basically the lower side.
Recording in progress.
And cause the bone dislocation of the tibia if the lunate bone remains in place, and the other couple bones are completely dislocated for dislocation of the lunate bone. This minimal investment approach is a reliable and favorable alternative in treatment of lunate injury. We recommended this type of fracture average 18 weeks. The rate of the union of the treat approach 50%. Arthroscopically guides continuous screw fixation. We achieve improved results over the results obtained using only the arthroscopy. Most reasonable alternative for achieving pneumatic reduction of the structural damage here. Advantage of open reduction and the internal fixation achieve the anatomical reduction. So it is used to be the most reasonable alternative. Many structures need to be repaired. The scaphoid is displaced. Cartilage injury to the proximal bone. Treatment of these injuries is necessary to prevent lasting complications such as mobility and eventual post-trauma hospitalizations. Although cross-treatment was historically advocated, several studies have reported that post-reduction and mobilized alone results in herniation of the scaphoid, interparallel segment instability, and unfavorable restart. Although both arthroscopic and open technique achieves the ability of injury risk in patients, Trans-Scaphoid, it's true that the arthroscopic assistance technique should clinical meaningful better depth score and better pressure extension up with the this study summarized the clinical experience of arthroscopic treatment of Trans-Scaphoid perilunate dislocation in Hua-San Hospital, Shanghai, China. A retrospective review including 7 patients, 1 year. The key procedure is complete debridement and the exposure of lower sides of scaphoid and lineage, then reduction will be achieved. The visual VAS and ROM and MMWS and PRWE. The information of the case is as follows. 24-year-old male who have right wrist pain caused by fall injury. 1 week physical evaluation issues like swelling, motion limited, operation room. This is so with the radial couple view from 3-4 portal, lots of red scenery in the space. Debridement was performed via 1-2 portal from distal parts of the scaphoid shifted to dorsal part. With the arthroscopy in MCR, unit could not be found. A soft tissue was found in this position. So we do the debridement of the middle calf joint via MCU portal. Radio frequency was performed from MCU and then order capture rupture found after debridement. The radio frequency RSC ligament and soft tissue found in scaphoid fracture. So with the probe in MCR portal, complete analysis of the volar scaphoid unit was performed. After the soft tissue, we then do the couple bone reduction. We can see the scaphoid reduction gets the right position. With the probing MCU portal, assessment of the dislocation in middle calf joint was performed. The portal in 3-4 SL ligament was found continuity. Then we use the hollow screw to fix the scaphoid and KY was used to fix the unit trapezium joint. Then we use the probing MCR. We can find the configuration in scaphoid satisfied after fixation. Before operation, the ROM and was significantly reduced, and the 1-year follow-up, the ROM of the wrist fracture fixation was significantly improved. Pre-operation pain, suffer severe pain, the wrist joint affected the sleep, and 1 year after operation, the pain improved obviously on my pain and did not affect the daily life. The result of the BAS, MMRS, PRWE were followed with a good function 1 year after. result of the grip strength of ROM, the wrist showed that the fracturing extension of the grip stress of the wrist and good function of the end. Nowadays, the management of TSPD remains challenging and controversial, but it is certain that arthroscopic assisted surgery showed better function outcomes in open surgery. And our experience is complete debridement and exposure of the molar side of the scaphoid and renate and the reduction achieved. So in conclusion, arthroscopic treatment of Trans-Scaphoid perilunate dislocation is a safe and effective procedure of the minimal invasive method. Arthroscopic assistant system, the technique should clinical meaningful better wrist evaluation. Wrist arthroscope it became an variable core in the surgical diagnosis and treatment of complex wrist surgery. Thank you all.